The Young Nurses Indaba trade union has welcomed the decision of the Northern Cape High Court to dismiss the urgent application blocking it from participating in protests. The union is demanding that the Provincial Health Department repairs the Henrietta Stockdale Nursing College, the only one in the province. According to the unions, the nursing regulatory and accreditation bodies reported that the college lacks basic proper infrastructure. Let's get into conversation for more on this. We're joined by Lerato Mthunzi, the Secretary General of the Young Nurses Indaba Trade Union. Thank you very much for availing yourself this morning. Tell us a bit more about the Henrietta Stockdale Nursing College and your concerns that sparked this court challenge.
This may be a little history lesson. Henrietta Stockdale is actually the first college to ever be able to produce the caliber and the cadre of nurses that we pride ourselves currently as a country. And this training obviously came from a legacy of real icons such as the very Henrietta Stockdale herself. Seeing that this college that has managed to expand itself throughout all the 9 provinces and be able to produce good nurses that we have, and we can't sustain, and we are not able to even maintain the infrastructure or even get it accredited to be able to also transition to higher education like the rest of the nursing colleges. It's actually a very a sad situation, to be very honest.
And you applied pressure on the Department of Health and they took the matter to court.
We had a scheduled meeting with the MEC of Health to look deep into this and to try and come up with amicable solutions. We are not sure where this progressive discussions that were also entered by the Premier of the Northern Cape, a delegate, where did they go pear-shaped? But it was actually a surprise for us where the HOD of the department in the province decided to lodge an urgent interdict against the trade union, against the SRC, as well as the members of the academic committee. And obviously, we're not going to take this line back, because this does not only affect the nursing community, it actually affects the community of Northern Cape at large. I mean, this college is in Kimberley, but obviously services the entire province. Like you rightfully said, it's just one college in the entire province that's producing nurses, and we know the healthcare system currently in the province is really in crisis.
The new Premier of Johannesburg, Panyaza Lesufi, Gauteng Premier, yesterday pointing out that they're going to have a big focus on hospitals in the townships. They want to make sure that people living in the townships have access to great facilities, and not just that. He also touched on the issue of the attitudes of staff members there. So when we take a look at the fact that South Africa does not have as many training colleges as it used to have, what gap is then left in the absence of these training colleges? Why were they important, I guess, essentially?
Yeah, I think the new Premier of Gauteng is spot on. We need to really zoom in as to not just why the colleges are closed, which has been a fight of Young Nurses Indaba for many years, to say let's open nursing colleges, let's train more nurses, let's produce enough staff so that we don't always sound like a broken record crying about the shortage of staff. But to be very honest, we have adequate academics, whether at university or college level, that are equal to the task of training and equipping nurses, and even upgrading them. Currently, as we speak, we have a big challenge in the profession where the nurses that have been trained cannot even develop themselves or even upskill their training, because they are forbidden from actually training. So yes, we need to zoom into those hospitals and clinics, and where we see lack of skills and lack of acumen from the part of the healthcare providers, we have to do that. But also just not, shying away from the issue of staff attitude. I normally say this is merely a symptom that we are seeing from our healthcare professionals, not because they lack soft skills, but because there is just too much that they're carrying. This elastic band has just been stretched way too far. Our nurses really have got a lot of issues that they've been exposed to, post-traumatic stress disorders. They've got anxieties, and this is what we've been crying about. We need to zoom in into how do we begin to actually care for the carers, which is something that the department in Gauteng and Northern Cape and most of these provinces that we talk about really have been failing dismally. They've been failing healthcare workers.
Where to from now, especially with regards to the Northern Cape?
Obviously, we are going to not stop to try and save Henrietta Stockdale. We are going to continue our talks. I think the destruction that has happened, we've seen textbooks arriving, we've seen the bare minimums that we're crying about in our memorandum being executed by the Department of Health in the Northern Cape. So the next step is to make sure that we tick all the boxes that are required by the South African Nursing Council as well as the CHE in ensuring that this iconic college gets accredited, and we are not stopping until we see that happening.
Lerato Mthunzi is the Secretary General of the Young Nurses Indaba Trade Union. Thank you.